Hello, everyone. Welcome to this podcast where we discuss important issues that matter. And today we will be discussing on blood pressure on adults. And we have our amazing guest in the studio, Nurse Debbie, a registered midwife nurse and a family planning provider, a certified family planning provider. So good to have you here, Nurse Debbie.
Thank you. Thank you. It's good to be here. I'm happy to be here to discuss this important topic because blood pressure is often called the silent killer. You know what that means. So
Exactly.
most adults don't even know they have it until it becomes dangerous.
Wow.
Yes.
So, just as she have said, most adults don't know that they have blood pressure until it becomes very dangerous.
Dangerous.
And today she'll be throwing more light on high blood pressure. And I want us all to listen carefully because we're going to learn a lot from this conversation. So, Nose Devi, let's go into the business of today. First of all, let me ask you, what is blood pressure?
Blood pressure is the force of blood that pushes across the walls of the arteries as the heart pumps.
Okay. Can you go over that again? Please make it a little bit
Okay.
a bit so people can understand it properly.
Understand.
Please break it down a bit.
Okay. So blood pressure is
Yes.
the force of blood. You know
Yes.
the way the blood force when we say something forces. Yes. So blood pressure is the force of blood across the arterial walls as the heart pumps.
Okay.
Yeah.
Okay. So thank you so much for that definition. So our second question is what are the causes of blood pressure on adults? Can you tell us?
We have several causes of blood pressure in adults. Some of these causes are unhealthy lifestyle,
Okay.
eating too much processed food, and eating so many junks, salty food. All these would lead to high blood pressure. Yes, lack of exercise. When you don't exercise regularly, it's advisable to exercise every day, at least 30 minutes of your day. Dedicate it into exercising. It will help. But if you don't do that, it will put you at risk of high blood pressure. When you have family history of high blood pressure, definitely, probably your mother, your father, somebody in the family, your grandfather has high blood pressure, you are at risk because you are in the same lineage with them. So you are at risk of blood pressure because blood pressure is hereditary. Yes, blood pressure is hereditary. Then if you have a lifestyle that you are mostly under stress, yes, anxiety, stress and anxiety too can put you at risk of high blood pressure.
Okay.
Yes, smoking and drinking, unhealthy lifestyle. Like I said, you smoke a lot, you drink a lot, can put you at risk of high blood pressure.
Okay, so you just stated the causes of high blood pressure, and you said you mentioned drinking,
Smoking,
smoking, unhealthy lifestyle, and you
family
family
history,
history of blood pressure,
pressure.
and you also mentioned stress. So now you're trying to tell me that all these are the causes of blood pressure. So people that take alcohol a lot, it's possible that they may be having a high blood pressure, right? And most especially people that smoke a lot too.
Yes.
Wow.
Excessive drinking and smoking will put one at risk of high blood pressure. When
Okay.
they continue it and they made it as a
A
lifestyle, yes, a
lifestyle.
routine, they take it excessively. Yes,
So
it will
it,
put
it
them at
it
risk
increases
of,
the high risks of
yes,
having blood pressure.
yes,
Okay, and you also talk about stress. So you know we have people that their work is more of it's a stressful job.
successful.
You know, most people work so hard. So you telling us that stress also causes high blood pressure. So for those people that work extremely hard, they do a very hard job, they go out every day. You know, let me just let me give example of those people that do those is it bricklayer or something like that.
Yes.
So there's a possible high chances of them having blood pressure.
Yes. Yes.
Okay.
Yes, there's every possible way that they are at risk of high blood pressure because, like I said, anxiety and stress. So,
Yeah.
if you are one of those people that you know your work is actually stressful, whenever you are having time to rest, or let's say, find a specific time to rest out of that your busy schedule,
Schedule.
yes, find time to rest, sleep properly. Yes, enough sleep at night is very important because if you don't sleep well, your body is not even at rest. So you need that rest and avoid anything that has to do with you getting anxious anyhow.
Wow.
Yes, yes. You breathe in and out. Just find a way to make everything
Wow.
calm
Easy,
for
calm.
yourself and easy.
Okay. And you made mention of family history of blood
Blood
pressure.
pressure.
So you're trying to tell me that, excuse me, let's just say a family whereby maybe their grandparents or their dad, their mom is having high
High
blood
blood
pressure.
pressure.
There is every possible chance of that person to one of them having blood pressure, isn't it?
Yes.
So how can you discover? How can you tell that you have blood pressure?
Yes. You have an history. Your family has this history of blood pressure, just like you said, your father, your mother, your relation. You should know that you are at risk of blood pressure because blood pressure is hereditary.
Wow.
Yes, so I would advise such a person to regularly check his or her blood pressure and make sure he avoid all these things I mentioned because already, of course, you are at risk.
Yeah.
So with that knowledge, you would be able to avoid all these things and make sure, most importantly, make sure you check your blood pressure regularly.
Okay, so my second question is, can this be harmful to our health? Can it be dangerous to our health?
Blood pressure can be dangerous, it can be harmful when not properly managed.
Wow.
Yes. Blood pressure can lead to heart failure. Yes, it can lead to stroke. It can lead to eye problems.
Are you serious?
Yes, organ damage entirely.
This is really serious, though.
Very serious. It's a silent killer, so you don't even know until it began to destroy most of your organs, and by that time, it's already too late. So it's very harmful and dangerous.
Okay. And thank you so much for this. Most people don't even know how dangerous blood pressure can be. And you just stated, you said it's a silent killer. It causes heart failure, right?
Yeah.
So now, before it leads to
Heart-
heart failure,
Failure.
that's to tell you that the blood pressure must have,
High, yes,
Must
it's
have-
very high.
wow. So
That's
that's
why
why
it's called high blood pressure.
it's very good to check yourself often to
Yes.
avoid all this,
Before it gets there, you would be able to manage properly.
so it can be managed.
Yes.
That's very good. Thank you so much, Nurse Debbie, for this beautiful explanation. So how can we keep it healthy?
Very important.
Very important.
Everyone needs to hear this. You need to take care of yourself. Like I mentioned while saying the causes of high blood pressure,
Yeah.
healthy lifestyle is very important. You need to eat healthy, stay healthy, eat balanced diet, avoid processed food. Make sure that your food or your daily intake doesn't have too much or excess salt in it.
So too much of salt causes high blood
Yes,
pressure.
too much of salt, yes.
Wow.
Will put you at risk. Then exercise regularly. Most people don't know that exercising is very important because when you exercise, of course, your heart will be healthy. Your heart will be strong. Exercising helps your heart to be strong. It also helps your blood vessels to be healthy.
Wow.
Yes. So exercise is a very important factor in keeping healthy. Good. Then avoid smoking and drinking. Excess, because I know definitely some people will come for me. Oh, she said, Nozebi said we should avoid smoking and drinking. Excess smoking and drinking. Please avoid it when you want to live a healthy life.
So let me also elaborate on this one. So for those of us that take too much alcohol and we smoke a lot, some of them will tell you that smoking makes them think very well. when they drink alcohol, it calms their nerves, and then it makes them forget about a lot. Most people, when you ask them why do they take alcohol, most of those alcoholic people, they will tell you that no, they need to calm their nerves, they need to think straight. And you see those people that smoke, often they'll tell you that it gives them a right direction, not knowing it's harmful to their health. So please, audience, Nurse Debbie just explained to us now that too much intake of alcohol and smoking, it causes high blood pressure. And just like she said, it can lead to heart failure. It can also lead to death, right?
Yes.
Very well. So in order for us to avoid all this and to take care of our health, we need to stop smoking, drinking, and then living a healthy lifestyle. This will help us live better. Right?
Yes.
Okay, thank you so much, Nurse Debbie. So my third question is, can young people get high blood pressure?
Yes. Young people can be at risk of high blood pressure and can get high blood pressure. Although high blood pressure is associated to older people. You understand?
Okay.
Is mostly associated with older people. But yes, young people can also get high blood pressure if they don't practice a healthy life. Just like I said, if they don't take precaution, they don't exercise, they don't eat healthy, they will be at risk.
What should we do when we have a high blood pressure, or if it's high?
So if your blood pressure is high and you are sure it's high after 2 or 3 readings and your record shows it's high, please go and see a specialist, see your physician, see a doctor to tell you what to do. Like I said, you'll be placed on antihypertensive drugs and you would be shown how to take it and when to take it. So most importantly, while doing all this, make sure you live a healthy lifestyle because it works hand in hand. You cannot be taking antihypertensive drugs, trying to put your blood pressure at check, and you are not living an healthy lifestyle. You are also putting yourself at stress, anxiety, you don't exercise, you worry too much, you still eat food with a lot of salt. You see, you're not helping yourself. So you seeing your doctor and also living a healthy life is what you should do after you've realized that your blood pressure is high.
Okay. So for those people that don't even know the symptoms of this high blood pressure, so how do we check our high blood pressure? Because I'm sure a lot of people don't even have an idea on how to check their high blood pressure. Funny enough. So please, I want you to tell us, how can we check our high blood pressure?
You can check your blood pressure at home.
Blood pressure.
Yes, you can check your blood pressure at home or in the hospital, clinic, chemist, pharmacies. Yes, as long as they have the blood pressure monitor. Because that is what we use in checking the blood pressure. And we have 2 types, the digital and the manual. So for the digital is what you can use to check your blood pressure at home. You can just use the cuff, put it around your upper arm, press start, and it automatically reads and record it. Well, the manual, you can walk into a facility, hospital, pharmacy, just tell them the healthcare provider there to check your blood pressure. He or she would use the stethoscope to take the reading and give you the records.
It was the time I was at the chemist, right, to get a normal paracetamol, and I saw there was this woman that walked in to check her blood pressure. So I noticed after they checked her blood pressure, I saw 2 numbers. One is big, one is small. So please, can you tell me, or can you tell us what does that mean? How do we know the rates? Which one is high? Which one is low? Yes.
Okay, thank you for this question because it mostly comes up.
Yes.
So blood pressure reading or records
Yes.
come in two numbers.
Two numbers.
Two numbers. That is the record. The systolic and the diastolic. The systolic
Okay.
is the number at the top. The diastolic is the one below.
Okay.
Yes. So that is why I mentioned that when you are going to check your blood pressure, make sure that you are checking it from a certified healthcare provider. Because I've
Okay.
seen these things happen. You see a woman comes, oh, Auntie Nurse, hey, my blood pressure is high. Oh, this is the reading. And after checking it, it's normal. So who told you it's high?
Just like I said, which one is higher, which one is low? Because I used to say some 100/10, 125/20. So is that one the heloscopy something? Abi the telescopy? So please, can you expatiate
Not
more on this?
heloscopy, please. I said systolic and diastolic.
Systolic and diastolic.
Yes, the
Okay.
upper number, the systolic, the
Okay.
lower number, diastolic.
Diastolic.
So normal blood pressure in
Yes.
an adult is 110 to 120.
110 to 120
over
over
70 or
Okay,
80
okay.
millimeters mercury. Blood pressure is measured in millimeter mercury.
in millimeter mercury.
Mercury,
Oh,
yes.
okay.
It's slightly high when it's 130 to 139.
Okay, pause. So it's slightly high when it's
Yes.
130 to 139 over 70. So it's normal when it's 120 over 50 or 70,
No,
right?
120 over 70 or 80.
120 over 70 is normal.
Yes.
Then 130
30
to
to 139.
139 over
over
70,
slightly
high. Okay.
So from 140 to 149, 140 above is high.
Okay, Nurse Debbie, please tell us. You've talked about high blood pressure. Please, I want to know, or we want to know, can blood pressure be low?
Yes, blood pressure can be low. In fact, most people again have low blood pressure.
Okay.
After the reading, you realize that, oh, the blood pressure is low. The normal blood pressure is 110.
Okay.
Let's just assume, okay, somebody just comes out, the other person, two persons go to check their blood pressure, and you check the other person, that is the first person, 110 over 170. Oh, perfect. Okay. Then this other person is having 50.
Oh my God.
Yes, so you can see from 110 that is normal, 50.
50 over what?
Yes, 50 over, let's say, 60
Oh God. Okay.
is low. The person is having low blood pressure. So please, the person needs to go and see a doctor. Yes, from there, like I said, the doctor will tell him what to do. He will place on drugs, fluid, just to help regulate the blood pressure back to normal.
So this low blood pressure too can be harmful.
Low
to
blood
our
pressure
health.
too can be harmful. Just the way high blood pressure is harmful, it can also be harmful. So you need to know if your blood pressure is high, low, or normal. It's very important for you to know that.
So I'm still going to ask you these questions. For our pregnant women outside listening to this conversation now, can you tell us the risks of high blood pressure and low blood pressure to their health?
Okay, for pregnant mothers,
Yes.
that is why I advise every pregnant mother out there to make sure she attend her antenatal classes.
Okay.
Make sure you don't stop going for your antenatal visits, because it's very important and essential. Because during your antenatal classes, visits, and teaching, they will explain this more to you, and you would know if your blood pressure is low or high. Because after the classes, your blood pressure would be taken. The nurses and midwife will definitely check your blood pressure. Is among the routine of antenatal.
Okay.
Yes.
Okay.
So after checking, they will direct you on what to do. For antenatal mothers, when your blood pressure is high and you are pregnant, that is eclampsia. Yes, preeclampsia, eclampsia. That is what we call it.
So in preeclampsia,
No,
sorry, please. I don't know how to pronounce that. And
eclampsia
eclampsia
and preeclampsia.
and preeclampsia. So what does that mean? What does enclampsia mean or preeclampsia mean? Sorry, it's not my profession, so I'll just call it the way I know how to.
Eclampsia is high blood pressure in pregnant
Mothers.
Yes,
Okay.
pregnant mothers. The complication will lead to preeclampsia.
Oh, okay. So what are the complications?
Yes, one of the complications is preeclampsia. That's the high blood, the blood pressure is
Hi.
high. Yes,
Okay.
so they will start noticing pitting in
Okay.
their legs, edema, blurry vision, headache, and all. So those are the signs.
Okay, those are the signs for pregnant women. Headache, dizziness.
Yes, headache too for other persons.
Okay.
Yes, headache too. Pregnant women will see that as a sign, but for them, other signs may be pitting, edema.
What's
Yes,
PT? What's edema?
pitting. Their feet will be swollen.
Oh,
There is
okay.
edematous. Then it will pit. When you press it, it go down. It's pitting.
Oh,
Yes, then
okay.
after series of tests, there's the urine test. The results will come out with probably protein. Yes, protein in the urine. 2+, 3+. All these are linking to their blood pressure.
So you
being
mentioned
high.
protein. Is it the protein we know? Is it the normal protein to keep a healthy lifestyle? What we should consume or what?
No, there are some things that are not supposed to be in our urine.
Okay.
Blood in the urine is not supposed to be there. Yes, protein in the urine is not supposed to be there.
So, Nurse Debbie, let me ask you this question for the purpose of our viewers and a lot of people watching this video. In a situation whereby somebody just collapsed due to hypertension and all that, and then everybody's running helter-skelter just to find a possible immediate remedy for that. It's what kind of, first aid is the first treatment given to a person, you get, right? So what do you think we can give to that person to help calm that situation at that moment?
First and foremost, you are not a doctor, you are not certified. So when they called you for that kind of scenario, oh, please come, this person has just passed out, and you asked and they said, oh, is a well-known hypertensive patient.
Yeah.
Yes. Try to call for help. Immediately take the person to the hospital. Do not try to give anything orally or try to know.
Yeah.
What you should do at that point is make sure that the person gets the help he or she need, because we had issues like that. I see issues like that they will say, oh, when they come, that is when they will know, they will start bringing concussion. Open the mouth. What you don't even know about, oh, no, please start arranging for a vehicle
That
to
will take the person to
down to the hospital for proper management. Is very important. Don't waste time.
Okay, so Nurse Debbie, you said concussion. You mentioned concussion. Can you please explain what is concussion?
Concussion is a general name for all those herbal things.
Agbo.
I'm not here to say, oh, herbal things doesn't work or they work. But what I'm saying is, at that point, that is not what the patient needs
At
there.
that
Yes,
moment.
at that moment. Because you don't even know if what you are giving will interact with the person present situation.
Yeah.
Yes. So please, or probably the person took a particular drugs before that scenario happened. You carrying your concussion, I don't know what it's mixed, different things mixed. Like I said, concussion is a general name for the mixture of so many herbal things that people believe worked. I don't know for that. So you carrying it to open the mouth of the patient, or to open the mouth of the person that just passed out, to pour it. That the person took a drug. Let's say the patient took a drug before then. It will interact. So you don't know about drug interaction and all.
Yeah.
So you shouldn't do that. It's not the way out.
Okay.
Like I said, the way out is arranging a vehicle, emergency. Take the person down to the hospital for proper management.
Okay. Thank you so much, Nurse Debbie. I really appreciate this explanation. At least it's helpful to a lot of us out there. So, we just talked about blood pressure, the causes of blood pressure, and how to live a healthy lifestyle in order to avoid being a victim of high blood pressure. Because a lot of us might be having high blood pressure without knowing. Yes, just like she mentioned, she said the causes of high blood pressure, it's alcohol, smoking, stress, more of processed food, right?
Yes, salty
and
foods.
avoid salty food and avoid stress. So all these will help us live a healthy lifestyle. And she also talked about family history of having high blood pressure. So most of us, it's hereditary. And most of us, we cannot tell if we have high blood pressure or not. So the best thing to do is to walk into any pharmacy or facility or clinic to check yourself regularly. Right? So we should often check our blood pressure to know if it's stable or not. And we all know that high blood pressure leads to heart failure, which can also lead to death. Yes. So in order to avoid this is not a minor issue. We should take it very, 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 very seriously. So high blood pressure can also kill. In order to live a healthy lifestyle, just as Nurse Debbie has explained, we should be able to take care of ourselves, do more of exercises. You said 30 minutes walk or
Every
30
day.
minutes to an hour. Any kind of exercises, you just do it to help stabilize your blood pressure and help it flow very well. So thank you so much, Nurse Debbie. It was indeed an awesome teaching. And so good to have you here. Okay, so you can follow us on our social media handle on Instagram, Deals Record, on TikTok, Deals Studio, YouTube, Deals Record, and Facebook, Deals Record. And Nurse Debbie, please, can you share your social media handle?
Yes. Actually, if you enjoy this discussion and you would want to see my face more often,
Okay.
yes, you can follow me on my social media page. For TikTok, at Mama Care Midwife. Instagram, Deborah Silas 14. Facebook, Silas Deborah. In my page, I give health talk, healthy tips on how to stay healthy and take care of yourself. Remember, health is wealth.
Yes, health is
I will
wealth.
see you in my page.
Thank you so much, viewers. So see you next on Deals Podcast. I remain your host, Oiza Daniel. Bye for now.